From KQED Public Radio in San Francisco, I'm Michael Krasny. Good morning and welcome to this morning's Forum program. And in this morning's opening Forum hour, as part of our ongoing California Election Watch 2014 series, we take up the debate over Proposition 46, which is on the California November 4th ballot. 46 would raise the ceiling on awards for medical malpractice lawsuits, allow for random alcohol and drug testing for physicians, and impose mandatory use of a prescription database to curb overprescribing and overdose deaths. Joining us to take up the debate on Prop 46 here in studio is Robert Pack, and he represents the Yes on 46 campaign. Welcome. Good morning.
Yes, good morning. Thank you.
Also with us this morning from Sacramento is Dr. Richard Thorp, and he is president of the California Medical Association, representing the No on Prop 46 campaign. Dr. Thorp, welcome.
Thank you, Michael. It's nice to be here.
Glad to have you both here, and I'm going to begin with Bob Pack and begin by talking about, this is, I should mention, a proposition that has a number of provisions in it, but let's start by talking about lifting pain and suffering and what is now essentially, and has been for the last 39 years, a ceiling. An index, the proposal is to make this higher. And what I'm talking about is the Medical Injury Compensation Reform Act, which set the limits 39 years ago. Bob Pack, you're talking about raising them for the first time since 1975 and putting that $250,000 limit up to what, about 1.1 million?
Yeah, that's correct. The law was set in 1975 and it capped non-economic damages, which is primarily cases where there's death and or severe pain and suffering, and it capped the ability for a harmed patient to be able to sue for a maximum of $250,000. But almost 40 years later, it's still at $250,000, and we want to adjust that for inflation because for $250,000 in today's money, a harmed patient or a death of a child, the victim's family can't even get an attorney to take the case because it takes that much in cost and expensive to even get to a trial. So the insurance companies get a free ride by not having to pay harmed victims.
The argument against this to some extent might be that this is just making more money for, I guess, what often pejoratively would be referred to as the ambulance chasers and the personal injury lawyers and so forth. And yet they haven't put a lot of money into the Yes campaign, which seems puzzling in many ways.
Well, it's not about lawyers. It's about patients. It's about harmed patients. The only way that a victim, once they're harmed, is to get accountability and closure and even some fair compensation is they have to hire a lawyer and battle the insurance company and go to trial. And so the idea that the No campaign has pitted this a thing for trial lawyers and it's all about lawyers, it's just patently false because even in Prop 46, the attorney rates are scaled down. There's a provision that caps attorney's fees. For example, under Prop 46, if a patient wins an award from a jury for $600,000 or more, the attorney's fees are capped at 15%, so nobody's getting rich off that.
Let me go to Dr. Thorp. Richard Thorp, by the way, I think it's about 10-1 in terms of the money raised on the no side, and yet caps disproportionately, so the argument goes, hurt women and children and the elderly, and we need an adjustment for inflation. There hasn't been one in 38 years. Why oppose this?
Well, thanks, Michael. So, first of all, just to clarify something, the cap on malpractice awards is not capped at $250,000. The only cap is on the non-economic portion of that award, which is the traditional pain and suffering piece. The actual awards since 1975 have outpaced inflation by 2.5%. So malpractice awards have actually increased in the amount that they have actually awarded to people that have been harmed in the healthcare system. So, in addition to that, although it is true that the trial attorneys have not raised as much, possibly all of the contributions have been, or a significant percentage, 95% of the money that has been raised for the Yes campaign is from the trial attorneys. And the truth is, this is about the fact that trial attorneys will, in fact, increase the amount of money that they make on a malpractice award 3 to 4 times. That will increase the frequency of lawsuits and the intensity of lawsuits. It will fuel a fire of frivolous lawsuits, and that's why there's a massive and growing coalition of more than 500 state and community organizations across the state, essentially every major healthcare, community clinic, labor, business, education, and civil liberty organization in the state, all have united against Prop 46 because it's costly to California taxpayers, it's deceptive to voters, it develops flawed healthcare policy, and it's dangerous for the future of healthcare reform.
Everything has been moving upward as far as inflation, though. Why should this be frozen?
So we can talk about the cap on non-economic damages, but Michael, that's not what this is. This ballot measure, unfortunately, is not just about this increase in the cap on non-economic damages. This ballot measure is about all three things together, three initiatives in one, all with far-reaching consequences for the healthcare system and state and local governments. The costs are exorbitant. The Legislative Analyst Office estimated that the costs of this ballot measure would be in the tens to hundreds of millions of dollars. A previous legislative analyst, Bill Ham, actually said the cost would be closer to $10 billion, $9.9 billion a year, which will be approximately $1,000 a year for a family of four in increased healthcare costs. This ballot measure can't be. This is not just a debate about economic damages or non-economic damages. This is a debate about this ballot measure, which throws all three things into one initiative, and the other two issues were actually only brought in because they were considered as sweeteners, which is not my word, that's the word of the proponents, that they couldn't convince voters to agree to raise the MICRA cap and make it easier for trial lawyers to sue doctors without adding them.
Yeah, I want to, in fact, get into the other two provisions, the so-called sweeteners, as you call them. But, Bob Peck, why have three provisions in one in this?
Well, first of all, on the non-economic damages, again, the CMA and Dr. Thorp won't answer the key question. Is $250,000 fair for the death of a child, a stay-at-home mom, or an elderly person? Is that fair? I mean, if the doctors and the insurance industry agreed that $250,000 would work for them and they were happy with it in 1975, why aren't they happy with the same value of that money in today? That's all we want to do is raise it. The doctor and the CMA are shifting the argument to economic damages. That's not part of Prop 46. Prop 46 is about protecting patients and giving them the right to accountability and fair compensation. If doctors are not held accountable through the court system, they have no incentive to change their bad habits or practice safer medicine, and that's what this is about. So again, they're throwing a smokescreen up that somehow they won't answer the question, is $250,000 fair for the life when lost due to medical negligence, and they won't answer that question.
Well, let's ask you at this point, maybe we'll hear more about that from Richard Thorp, but about the second provision, which has gotten a great deal of attention, and which you personally, unfortunately, suffered a great tragedy with. Two of your young children were killed by an overprescribed doctor, a woman doctor, who is now in prison. That was back in 2004, so obviously you have a very strong personal and vested interest in the idea of protecting and saving lives, with doctors being essentially accountable or held accountable by going through testing. And medical errors, we should say, is a number 3 killer. But, of course, the argument against that is that it would be expensive to put all these doctors through testing, that there's not been any real empirical evidence to show the link between doctors, although many doctors have said they've been impaired and all this testimony outwardly, but to actually make it an invasion of privacy and also a need to prove the link between substance abuse and many of these injuries that occur, or medical errors that occur. So talk about why this is important as far as a centerpiece to this provision.
Okay. So just over 10 years ago, my two children, Troy and Alana, they were 10 and 7, were out for a walk with my wife. They were run over by a woman. She was actually a nanny, a professional nanny by her living, and ran them over, and it killed my two young children and injured my wife. And so part of the repercussion of that was that there were numerous doctors, about 6, that all worked at the same HMO, locally in the Bay Area, and they were recklessly prescribing hundreds and thousands of painkillers like Vicodin to this woman, and they never verified her injuries. They didn't share a medical file, and they didn't talk to each other. And so I found that to be a nationwide problem and a California problem, not just Bob Pack's problem. And so I set out to do something about it. And part of it is creating a database that tracks all these narcotic prescriptions in California. That's been going on for 25 years. I helped the state create an electronic version so doctors could know if they're prescribing recklessly to a doctor shopper or not.
So that would curb the overprescribing and the overdose.
So that would that would stop the reckless prescribing to doctor shoppers in its tracks. Now, New York, for example, is a state, one of 3 states that has already made this requirement, and they're saving that state several $100 million a year. And we've studied that California would save over $400 million a year from the repercussion of crime related to prescription narcotics, fraudulent prescriptions through Medi-Cal that they pay for, emergency room visits, police, judicial. Those are a huge cost impact on California. And this Prop 46 will save the state hundreds of millions of dollars a year. In addition, it will save lives, because that's what this is about.
I'm so sorry for the tragedy you had to endure, and you've touched upon the third now, part of 46. But back to the second one, which I initially mentioned. Why put doctors or hospital workers through? I mean, I know the argument essentially is it's done with pilots, it's done with truck drivers and so forth. Why not with medical and health workers? That's essentially your argument.
Yeah, well, they're the only profession left that holds people's lives in their hands that aren't tested. And the example is pilots. They proudly test their pilots, and they do it successfully. And it's a terrific deterrence for pilots abusing drugs or alcohol, and it sends us a message to the public. If you travel on an airline in the United States, you're assured that our pilots are not abusing drugs or alcohol. Now, we have it in this provision of Prop 46 because the California Medical Board, which was set up by the legislature to protect citizens and be able to be a vehicle for doctor complaints and wrongdoing. They're frustrated because they've identified that California has over 3,000 doctors currently practicing abusing drugs and alcohol.
Actually, they say 1 in 5 will abuse drugs or alcohol during their career.
During their lifetime.
Yes.
1 in 5 during their lifetime, but currently practicing today, they've identified over 3,000. Now, who are these 3,000 drug-abusing or alcohol-abusing doctors? It's mainly prescription narcotics because of their ease of access. So because the the California Medical Board is so handcuffed, they have no approval or no ability to identify these doctors. And the CMA and Dr. Thorp, they won't address this issue through their own association. And so we're literally forced to put this provision in to protect patients.
Let me get Dr. Thorp's response to this. Richard Thorp, let's talk about that provision that required testing, drug testing. From your perspective, is a concern with privacy invasion with this, or again the need to provide evidence that there is real substance abuse and injuries are related to that substance abuse?
So, Michael, and first of all, I just want to agree with you. I mean, in the sense that my condolences also to Mr. Pack and his family, and to all victims. Actually, nothing's more important than patient safety. Unfortunately, this ballot measure is 3 ballot measures in one. You don't get to just do one of these things. As I said earlier, the costs of this ballot measure are significant. It makes it harder for community clinics to keep their doors open and serve their patients. And we think that California voters are smart enough to figure out that this isn't going to this drug testing piece is not going to create the protection that they need, but will in fact increase the costs for these new government mandates. Just to go back to the California Medical Board issue, just this weekend, the Sacramento Bee in its ad watch basically pointed out that earlier this year, this statement that you're making about 1 in 5 doctors, the California Medical Board clarified that it does not have any empirical data on the number of physicians with substance abuse problems. The board says they don't now and have never collected this type of information. So I'm not sure where Mr. Pack is getting the numbers that he's quoting, but it's clearly not something that the medical board is identifying.
Well, I don't agree with that. I mean, it's well known that 2% is a number that's been used widely of doctors. There's about 150,000 or more doctors and dentists in California, so 2% of 150,000 is 3,000. It stands up to every metric available. In fact,
let me cut to the chase here for a minute, Bob, excuse me, because there's a physician named Stephen Lloyd, a doctor who actually works in the White House Office of Drug Policy, and he said he was working as a physician a number of years while he was drug impaired every day, and now, looking back, is scared to death that there are others who are like him. I mean, just from that, that's not, maybe you could consider it anecdotal as opposed to numbers, but, one physician like that could have been drug tested and perhaps a life could have been saved, Dr. Thorp?
So, Mr. Lloyd, Dr. Lloyd is an interesting example. Dr. Lloyd had the advantage of being part of a health and wellness program in his state where he was practicing, not California, and he was able to deal with his addictive problems. There's an ad that just came out this week that Proposition 46 backers have put in the Bay Area, citing the number of 500,000 healthcare practitioners that are using or abusing drugs or alcohol. First of all, that's a national number, not a state number, and it relies on a federal report that found 103,000 healthcare practitioners abused illicit drugs and 400,000 reported alcohol dependence. The numbers include registered nurses and home health aides. This ballot measure will only test hospital-affiliated physicians. It doesn't test the number of other healthcare workers that might be out there. And the issue is also that there's no testing of doctors in the outpatient world. So do we think that patient safety is important? Absolutely. I've been practicing medicine for over 30 years, and patient safety is the highest priority for me. What I think is important, though, is to make sure that that is done in an appropriate way. The way this ballot measure is written, it would use drug and alcohol testing randomly for doctors in the hospital, and then it would also do it if there was within 12 if an adverse event was identified within 12 hours of that event being identified. If you, as a physician, were part of the healthcare team within the 24-hour period around that event, you would be required to come in and give a drug screen of some type. The issue is, this is the first time that off-duty practitioners, off-duty professionals have ever been asked to give a urine drug screen.
And that
there is no other state in the union that requires urine drug screening for physicians, and that's why this was only thrown at the last minute as a sweetener by the proponents, the trial attorneys and consumer watchdog, because they found that it polled well.
Well, it did.
The fact is that in California we don't have a physician health and wellness program, and that actually is because the proponents have opposed the development of that. They actually destroyed the one that we had through the medical board several years ago, and we don't have one now.
Let me get a response from Bob Peck. Yeah.
Well, I'm glad Dr. Thorp identified that there's more than 100,000 doctors abusing drugs in the United States. And if you look at just California, which represents about 10%, so that's well over 10,000 doctors right there he's admitting to that abuse drugs. Why, if you look at just the idea of doctor drug testing, why not do it? Why are they so opposed? They come up with all these answers. Well, the doctor, 12 hours later, he could be on vacation. Well, who cares? If it's an adverse event, he needs to be identified if drugs or alcohol played a role in that. Now, last week, the LA Times did a poll on Prop 46, the LA Times USC poll. And 68% of Californians favor drug testing doctors because it's about their patient safety. They want to be assured that drug or alcohol abusing doctors are not treating them. So what's wrong with identifying these doctors and getting them into treatment so they can sober up and come back and practice?
As long as we're talking about poll numbers, the numbers have gone down in support of 46. That may be in part due to the fact that they have 10 to 1 the money, the no side that you have, but also maybe because a lot of people are concerned. In fact, Contra Costa Times had a whole editorial, and they said, geez, we're in favor of 2 of these things, but one we're not in favor of. In other words, the fact that it's just a package of 3 things.
Well, it's a package because the CMA, we've tried to get these issues through the legislature, and the CMA and the insurance industry and pharmaceutical industry have fought them. I've brought several bills through the legislature regarding the prescription drug tracking program, trying to get the increase on the cap on damages for harmed patients. The legislature won't deal with it because the heavy lobbying hand of the CMA and the insurance industry has killed it every time. There's no other path for these safety measures but to bring them to the people. Now, the polling, it's really ironic because in that same LA Times poll a week ago, it came out 61% favor Prop 46, 61%, 29 opposed after reading the title and summary.
Excuse me, Bob, because we're coming up on a break, and I want to just get Dr. Thorp on the record here about the database. Just as a separate provision of this, it would curve overprescribing and overdose deaths, according to proponents like Bob Pack, and you are opposed because? And it would save money, he said, as well, yeah.
Well, actually, the truth is that the main motivation for this is clearly to raise the cap on non-economic damages. These other measures, when you actually look at the polls, when voters are informed, yes, it's true. When they just look at the title and summary, that's what those numbers hold. But when you look at when the voters are educated, when the poll people are educated about the costs of this measure and the actual details of the measure, the numbers in support of Prop 46 completely evaporate, and the no proposition, the vote no, significantly is in the majority.
All right, let's have our listeners weigh in on this. It's almost like trial lawyers and consumer watchdog people against doctors and insurers. And there are 3 provisions to this. We're talking about Proposition 46, and you can weigh in right now. Our toll-free number, 866-733-6786. Want your opinions, want your questions or comments. Again, 866-733-6786, or email forum@kqed.org, or go to our website, kqed.org/forum. Here's what's coming up on Forum in our second hour this morning. The race for California Secretary of State. We'll be joined by Democrat Alex Padilla and Republican Pete Peterson, the 2 candidates vying for that office on the November ballot. Tomorrow on Forum, we'll discuss the United Nations Climate Summit being held in New York this week. And for updates on shows and guests, find us on Facebook or follow us on Twitter. We're at KQED Forum.
Support for KQED comes from the California Society of Certified Public Accountants, whose members provide professional services that help California companies grow and families build financial security. More information available at calcpa.org. And by Stanford Healthcare. Every day, Stanford medicine doctors renew their determination to push the boundaries of what is possible in research, treatments, and patient care. Discover more at stanfordhealthcare.org. After 4 decades of military service and countless experiences with military intervention, retired General Anthony Zinni is well aware that wars are not always decided on the battlefield. He'll be the featured speaker on It's Your World, a program that comes your way tonight from 8 till 9 o'clock, and is repeated tomorrow morning beginning at 2 here on KQED Public Radio.
This is Forum. I'm Michael Krasny. As part of our California Election Watch 2014 series, we're having a debate on Proposition 46, an initiative which would raise the ceiling on awards in medical malpractice lawsuits and allow for random alcohol and drug testing of doctors, and also index medical negligence, and also have the medical indexing in terms of prescriptions set off in a different, I want to get the language right here, because this is one of the more complicated elements of this provision. Why don't you state it for us, Bob Pack, because I'm floundering around here.
Yeah, it's okay. It's drug testing doctors. It's requiring doctors to check the state database on prescription narcotics before prescribing to cut down on doctor shopping of painkillers, and it's to raise the non-economic damages for death of a child or a stay-at-home mom from $250,000 set 40 years ago to adjust it for inflation. So harmed patients have a path to justice and accountability.
Okay, and I should say, by the way, I said before we went to the break that we have the pro side with trial attorneys and consumer watchdogs, the anti-side with physicians and insurers, but Nancy Pelosi and Barbara Boxer are on the yes side. So is Aaron Brockovich, who supports this to save lives. On the other hand, and this is fascinating, really, those in opposition include, for example, California Teachers Association, the ACLU, the SEIU, one of the biggest unions, the NAACP, and the California School Board Association. A listener writes online, I believe Jerry Brown in the original MICRA, that is the Medical Injury Compensation Reform Act, author Barry Keene said the caps needed to be raised back in 1993, and yet we still have gone another 20 years of inflation with no change. This listener is in favor. And here's a listener who is opposed, who says, John, I'm a retired trial lawyer. Trial lawyers were on the front lines fighting mandatory drug testing laws as an invasion of privacy. To now inject mandatory drug testing into a provision dealing with non-economic damages is cynical and disappointing. I support lifting the cap on damages, but will never support mandatory drug testing. I fear I'll have to vote no. And you can see just by those two responses how this gets to be very challenging in terms of stating your own position, and we'll hear from listeners on this. Again, you can join us toll-free at 866-733-6786 or email us forum@kqed.org, or go to our website, which is kqed.org/forum, and click on this segment, or tweet us. Our Twitter handle's @KQED Forum. Dr. Richard Thorp with us is president of the California Medical Association, representing the No on Prop 46 campaign, and here in studio, Robert Pack represents the Yes on 46 campaign. And let's go to your phone calls, and we'll go to Billy Lynn. Good morning.
Good morning. A couple of months ago, I was approached in my local grocery store parking lot by a poll taker asking about the issue with the random drug testing on the doctors. And she said, well, don't you want your doctor's drug tested to make sure that they're not under the influence of alcohol or drugs and they're treating you and your family? And I said, well, absolutely, I do want that. But recognizing what people put into to have a medical practice, I think that it's probably a very small percentage of people who are affected by this. And so I said, how is this going to be paid for? And I started looking at all the paperwork in there. She said, well, I don't have any idea. And she really didn't understand the depth of this issue. And I started looking through it, and the estimations were astounding about the cost for this. And there was nothing there saying about how it was going to be paid for. And my understanding is that the majority of our state budget goes for the prisons and the schools. And so if there's no way to pay for this, that means that all of the school children in the public schools will be affected by this. Even though my heart goes out to the families, the small percentage of families who are affected by this issue, I don't think it's fair that without another way to pay for it that we affect all the children.
All right, Billy Lynn, I thank you for the call. Let me go back to this question of cost, Bob Pack. It was raised by Dr. Thorpe before, and where's the money going to come from?
Yeah, it's that's a little bit of misinformation that she's citing. The hospitals bear the cost of the drug testing of doctors. It's not set out to the public sector, so education in schools would not be affected at all. In fact, Prop 46 by doctors using the cure system will save $400 million a year to the state and local governments. It's interesting because for me, that significant savings every year for the state can be used to help education or other progressive programs that benefit society, not take money away from our state budget.
And your rejoinder, Richard Thorp?
Yeah. So first of all, the cost of the overall cost is going to be a significant amount of increase in medical malpractice lawsuits frivolously. This is going to encourage a much higher number of lawsuits. That's where the increase in cost typically will be. It's going to cost counties and the state hundreds of millions of dollars. Overall, it's going to cost, the legislative analyst Bill Ham suggested, $9.9 billion in additional healthcare costs, an extra $1,000 per family of four. And let me just say this about the Cures database. I mean, I think the Cures database is a good idea, but it's been chronically underfunded. It does not work properly. It's difficult to get access to it. And the idea that we're going to go from a few people using it today to every pharmacist, physician, veterinarian, physician assistant, nurse practitioner, as of November 5, Mike Small, who works in the Department of Justice and is the person that manages the Cures database, testified before the medical board in late July saying there is no way that this database could be ready. So you're going to put doctors in a position where they either are going to be having to obey the law or trying to figure out how they're going to take care of the patient that's there in front of them and break their Hippocratic oath.
Would you, Bob Peck wants to get in here, but Dr. Thorp, would you concede, though, the mandatory prescription database would curtail or diminish prescription drug use if it was up and operating and running right?
So I use the Cures database almost every day when I'm in my practice. I work in a private practice and I work in a small rural health clinic, and we use that database. But, I mean, honestly, right now I have a number of providers who cannot get their password for the Cures database. More than 10, 14. I have a person who applied for the Cures database over a year ago and just a week ago was only able to get onto the Cures database and get a password. It's a very the idea is a good idea, but it's inadequately funded. And in fact, the CMA last year worked with Senator Mark DeSaulnier on Senate Bill 809 to actually fund the Cures database by increasing our medical board fees by a certain number of dollars per year. That will actually fund the Cures database, but that will not be ready for a significant period of time. The database needs to be reworked. It's not ready for prime time, and this ballot measure is not the answer for that approach to patient safety.
Again, Richard Thorp is president of the California Medical Association. Bob Peck.
Yeah, well, I'm glad to hear Dr. Thorp and the CMA actually supports the Cures program, the electronic version, and supports the idea of stopping doctor shopping. So that's we've got them on our side on one of the provisions. Now we just need them on two more. But, you know, look, this is the issue. Dr. Thorp is right. They're helping fund the program. It's put together through that Senate bill 2 years ago, which I worked on, to provide $3.5 million to upgrade the Cure system, and it's being upgraded right now to accommodate Prop 46 and be implemented for 200,000 doctors to use the database. So I look at it this way: they're wishy-washy on their answer. They support it. Their doctors support it. It's on their website saying we encourage doctors to use it. We support the program. But here today, you know, he's saying, well, we can't use it. So fundamentally, this is the right way to go. Doctors need to be using it. It's 49 states have databases, 16 electronic, and 3 mandatory requirement of checking the database. There's no reason California doctors shouldn't be using this database.
All right, let me go to more calls here. We go. Retz in Oakland. Good morning. You're on the air.
Good morning, guys. How are you? I think that the drug testing is my problem, really. The previous woman brought out a bunch of very good points, but for me, I'm a cancer survivor. I had such difficulty getting pain medication. I had tongue cancer, for God's sake, and I think it was just a nightmare. And I don't understand. I feel so horrible for people that doctors or family was killed. It's awful. But what happens is sometimes people don't really need those meds. I'm going really through a lot of hoops to get to them. So I'm against it. Thank you.
Okay. Thank you for your opinion. Appreciate hearing from you. And we'll hear next from Melanie. Good morning.
Good morning. As a resident of San Ramon, I was very touched by the story of Mr. Pack, but didn't really think about any of these issues until I was in rehab myself earlier this year, and was there with many people in recovery who had gone through the same kind of pharmacy shopping for their addictions, as well as working with physicians who had been on that path and were now in recovery. And the number that Dr. Thorp suggested in terms of how many physicians this affects seems awfully low to me when I think about how many physicians we each see for different things and how many of them could be facing addictions or usage of medications that can impair their judgment.
Bob Peck.
Yeah, well, that's true. I mean, look, doctors are no different than any other profession in society. There's estimated of maybe 8%, 10%, up to 15% of society abusing drugs and alcohol. Doctors have a preference towards prescription narcotics because they're doctors and they get easy access to it and they're not illegal if you have them in your possession. And so we need to discover who they are, get them the help they need. But nobody's against doctors. I mean, this is about protecting patients. This is about their protection and their safety, family safety, and that's what this ballot measure is entirely about.
You talk about safety-sensitive professions. You have, truck drivers, train engineers, ship captains. I mean, there's a whole list. Pipeline emergency people, who go through required drug testing, and physicians are not in that category yet. I'm wondering, Richard Thorp, though, to get back for a moment, if we might, to the medical malpractice part of Proposition 46, could I just get you on the record here if you feel medical malcap that the numbers need to be upped?
Michael, we could have that debate. We can have that discussion, but what we're talking about is Proposition 46. Proposition 46 is just not increasing the cap on non-economic damages. It is, truthfully, I think that's the reason the proponents have put this proposition on the ballot, is because that's the real goal, is to increase the payout to attorneys by 3 to 4 times. That's what the real goal is. But it has these other flawed measures. Even the San Francisco Chronicle, in their editorial, said that this measure overreached in a decidedly cynical way. The proponents openly admitted that the provision for random alcohol and drug testing was added as a political sweetener, and voters should not be fooled by the title and summary. So it's not just us. It's not just doctors. It's citizens. It's voters. It's every major healthcare organization in the state. It's the organizations of business and labor. Both parties have come in against this measure. The trial attorney, the ACLU and the California School Board Association all have come in against this because of the fact that it increases cost and will decrease access. And not only that, but the Cures database has this really sort of difficult thing about patient privacy, because now you're going to have a database where many medications are going to be exposed to this database, and as we just recently have been hearing about Home Depot and many other databases that have been hacked, this will make it a target for hackers. Healthcare, the New York Times basically said that healthcare databases are one of the highest targets for hacking. So for all of those reasons, this is why there's such a large coalition opposing this.
Yeah, I want to go to more of our callers, but let me just go to a point that Dr. Thorp raised here about those in opposition. And let's talk about from the other side with you, Bob Pack. It may be if you raise the amount on pain and suffering, you're going to get more people who now don't have access and can't afford trial lawyers to be able to hire a trial lawyer. I think that's part of your argument, but it will be a bigger payday for trial lawyers as well. And I think of the amount of money that's been contributed so far to the Yes campaign, about 97% of it is trial lawyers.
Well, they're the only ones out there that have any kind of interest in helping patients. You cannot get to court if you're harmed by a hospital or doctor. That's your only path, and your only path is to hire an attorney and protect your rights and try to get either some compensation and accountability. Let me tell you a real-world example. After my children were killed, the 6 doctors who willy-nilly prescribed thousands of Vicodin to this woman, I couldn't get an attorney to take my case. So they valued my children's lives at zero, not $250,000. Like many harm victims in the case of death, you never get to court, and these families are shut out from justice. It's just not the American way. So what I don't understand is why Dr. Thorp and the CMA will not answer the fundamental question, is $250,000 fair for the life of the child? If it was good for them in 75, why not today? They dance around that question. They will not answer it directly.
Well, you have answered, Dr. Thorp, in a number of instances, saying, it's the whole 46 that you're opposed to here. But can I actually get you on the record about whether that seems like a fair amount or it needs to be raised?
Well, so, Michael, I'd like to go back to something that Bob said earlier, whereas that attorneys are the only people that care about patients. That is blatantly false. The California Medical Association has stood with patients and patient rights and patient protection since its inception. That is one of the standards of the California Medical Association to protect the public health. So I'm a little offended by that remark that attorneys are the only ones that care about patient safety. The fact is, there's no amount of money to actually. How do you quantify the amount of what a life is worth? Back in the day when the legislature actually decided this solution, this compromise, which it was at the time, it was a compromise solution that allowed fair distribution of the cost of being injured in the healthcare system, unlimited economic damages, unlimited wages, future lost wages, unlimited punitive damages, and in addition, $250,000 for the non-economic damage piece. There are a number of states who have recently just put in that same amount of money as their cap within the last few years, last 4 or 5 years, or very close to that. So we are all about patient safety, but we also have to find, and I think society has to find, a balance between how do you adequately give people restitution without the rest of society having to bear such an heavy burden that it cannot bear the weight. In the 1970s, because of the fact that non-economic damages were so excessive, that's when malpractice companies fled. OB doctors could not be found in the state because you couldn't get an OB doctor to take your case. Neurosurgeons, orthopedic surgeons, and those patterns have been repeated in New York State. There are 14 counties that don't have OB doctors. In Texas, before they got a cap, there was 1,000 square miles where you couldn't find an OB doctor, a neurosurgeon, an orthopedic surgeon, and it wasn't until they instituted a cap on non-economic damages that doctors were able to come back into the state and practice with some sense of stability for the future of their ability to practice medicine. That's what this is about.
Let me go to another caller, and Bill, join us. Thanks for waiting. You're on the air.
Yeah, I am a medical malpractice attorney on the plaintiff side, and that's all I do. I don't think that the tort system is the best regulatory system in the world for medical malpractice, but it's the only medical system, the only regulatory system that we have at the moment. Doctors fight against a better regulatory system. And so the legislature a long time ago set this up for all industries, that lawyers privately would advocate for people who are injured by modern industrial life, including medical care. And what's happened, because this cap was passed in 1975, people said that's a fair amount. But 40 years later, by not indexing the amount to inflation, they've cut the legs out of the only regulatory system there is for medical malpractice. I mean, there are some private regulatory systems that deal with this, like the Joint Commission, but they don't do it effectively. And basically 400,000 people a year is the current estimate die from medical malpractice. That means about 15% of that 400,000 are dying in California. And it's all concealed. Each hospital keeps its own records. There's no statewide database to show why these errors are being made or how they're being made. So when I take a case, I know that I'm going to spend a particular case, just depending, I can spend anywhere from $50,000 to $150,000. If it's a dead child or a dead wife who doesn't work or an elderly person, the maximum that I can make is $60,000 on these cases. I lose about half my cases. I win about half, which is a great track record for a trial attorney.
Bill.
So I make 50, I lose 50. The only way I can make a living, actually, is through the cases that I settle.
Yeah,
Otherwise, I break even on the cases that I try to award.
Yeah, I appreciate your calling in and breaking this down economically. I'm sorry, you had something else to add. Go ahead.
So I can't take the cases.
Yeah.
There's almost no attorneys left in California. I'm probably the only one that anyone knows in the Bay Area that does solely medical malpractice. Nobody can afford to do it. I mean, I put my economic security on the line to do this work that people don't even understand. Nobody knows. And the reason that lawyers do this is because we actually care about our clients. We care that they're injured. No one else even knows the scope of the problem. That's the biggest problem there is. The number of victims, considering the number of contacts between patients and doctors, is relatively small.
All right, Bill, you make an impassioned plea, and I thank you for that. I do have to move on, though, and Bob Pack wants to add something here. Bob?
Well, Dr. Thorp was citing all these reasons regarding the cap, and if you peel back the onion on this whole issue, what you're going to find is the medical malpractice insurance industry against harmed victims. And the big money of the medical malpractice industry, they've put up $44 million to fight Prop 46 from just a handful of just a few medical malpractice insurance companies in California. And the reason that they're putting up $44 million is because they don't want to pay harmed victims. And when you are harmed through severe pain and suffering or the death of a loved one, you're not going to get any compensation.
Yeah, but I should tell you that we're getting a lot of responses of people who support that part but think that there's too much in the way of a tripartite proposition here. It's too confusing. Or actually, let me read some emails and then go to more calls. Rich writes, I'm against making law in this manner. However, since the medical associations own the legislature, I would be interested in voting in favor except for the sweeteners. Loading up these propositions with these add-on provisions designed to appeal to the uninformed is insulting. I am not in favor of alcohol drug testing without reasonable cause for anyone. I'm strongly in favor of eliminating a cap on damages entirely. However, Mr. Pack and his friends have turned a yes vote to a no. That's a kind of response. Lisa writes, I'm voting yes. A drunk anesthesiologist screwed up my spinal during the C-section of my child, nearly killed both of us. I smelled alcohol on his breath. He was belligerent to me, threatening me with general anesthesia, raising his voice, flirting with the nurses, creating chaos in the operating room. I wanted to be awake to see my baby, and the rest of the team saw no medical need for general anesthesia and talked him out of it. If I had been under general anesthesia, I would not have seen any of this. It makes me wonder how many doctors are impaired in the operating room. The birth was extremely traumatic. And another listener writes, lawyers serve the public interest and represent people at their most vulnerable with lifelong repercussions. Data suggests there are severe drug and alcohol problems in the law community. Maybe a prop with drug and alcohol testing for lawyers would be a good follow-up on this next year. And one more listener, Pete, says, I've heard that the main Prop 46 proponent, Bob Pack, stands to gain tremendously financially if the state prescription database is implemented. He created and owns the drug database, Cures database. Is this true?
Absolutely not. I volunteered when Jerry Brown was Attorney General to help construct, build, and design the electronic version. I spent years on it. I spent significant amount of money, of my own money, to help with that cause. I've not been paid a single dime in 10 years since the death of my children for anything I've worked on in the last 10 years.
You see how rumors can get started. But there's another listener who wants to know about the database. Randy says, if the database isn't ready, why bring this to the people? Maybe the legislature had good reason to not do it yet. It's easy to blame lobbyists. I'm a little tired of end runs around the legislature with propositions like this that people won't fully understand before they vote.
We've taken these issues to the legislature, and they can't be tackled there. Like I said, the CMA has fought the increase on the cap. They fought the mandatory use of the Cures database, even though they're funding it. It's a very
Why not
mixed
have
message.
them set up as 3 propositions, though? I mean, for example, one listener says abolish medical malpractice suits and use arbitration. The other provision should appear on a completely separate referendum.
Yeah, there's a reason for that. It takes $2 million, and that's what we've spent on Prop 46 just to qualify it for the ballot measure. We don't have the big money that the insurance industry and the CMA has backing them from hospitals and insurers. We don't have $58 million. We have a very limited amount of money. It would take $6 million just to qualify these 3 components, and then we'd have to support them. And it's just not feasible. So we have a single measure about patient safety.
Let me go to another caller, and that's you, Andy.
Michael.
You're on. Good morning.
Good morning. So actually, I believe my question was about the same. Why was if the goal was patient care, why were these two, the prescription drug database and the increasing the caps change? But I guess I could, since that was already answered, I did want to add that most of these trial lawyers that are funding the bill, they haven't. I know there's some that have been in the operating room, but most of them have never. They don't know what the meaning of patient care is. So I think it's really misleading for the yes folk to say that it's, that the trial lawyers care about patient care. They're not the ones that are day in and day out treating patients and trying their best to make patient lives better. And
Andy, I appreciate the call, but I want to go back to Richard Thorp. I know you had something you wanted to add here, Dr. Thorp, and maybe you want to respond to Andy. Go ahead.
Thank you, Michael. Well, I appreciate the support that Andy just mentioned, that it is doctors and other healthcare providers throughout the state that are on the front lines every day trying to make sure that patients get safe care. But I'd like to go back to something that was said earlier about the fact that there's never been a cost of living adjustment. The truth is it was the trial attorneys who rejected a cost of living adjustment originally in the original language back in 1975. In a potential agreement back in the late 1990s, they again rejected a cost of living adjustment. So it's not been the California Medical Association or our allies that have been holding this hostage. It is the fact that they've never been satisfied with the amount of restitution that they are currently getting.
All right, let me conclude actually with a completely different wrinkle. This is Jill who emails, the elephant in the room not being discussed is the insurance industry that's screwing over both doctors and patients. The insurance extortionist industry is the one laughing all the way to the bank, pitting patients and doctors against each other without even being part of the discussion. Unless and until the issue of the big insurance companies is addressed by society, all these propositions and laws will do nothing more than cause further distortions in the system, which will only hurt regular people and benefit the top insurance companies, the banks that own them. Both the doctors and patients are victims. We'll end on that. I'm Michael Krasny.